Hi, my name is Melissa. I always knew that I was interested in something in the medical field, but I was never 100% sure what I wanted to do. And when I first went to college, I chose nursing, but still wasn't sure that it was what I wanted. And then at the start of my freshman year, my grandfather became sick, and he became a patient in the ICU. And we ended up having to spend the holidays that year with him there, where he was on a ventilator. And the nurses, I always found, were very caring with him, and they were very competent in what they were doing. And after that, it kind of took my doubts away, and I knew that it was what I wanted to do. I initially thought that nursing was a lot of what you see on TV, in which you see the nurses giving meds, doing baths, saying yes doctor. What I didn't anticipate was that there's a huge critical thinking aspect that goes into this job. You need to be able to understand the patient's diagnosis thoroughly, you need to have really accurate assessment skills, and you need to anticipate their needs. A lot of times what people don't realize is that a patient condition can change almost immediately, and you need to know that sometimes you're going to be the first one there. It probably will be the first one there because you have the most interaction with the patient. And so it's very important as nurses to be confident in your abilities and be able to act on them to help the patient. We're taught in school how it's very important to look at the whole patient holistically. So we want to look at them not just as their diagnosis or as a certain nursing task that we need to perform. We need to look at them and understand the emotional component that's going into their hospitalization. And a few years ago, a nurse gave me some really good advice that has had a great impact on me and has stuck with me, which is that the family is also your patient. And carrying that with you will definitely help in practice, and it'll help make you a better nurse. I found it most enjoyable to be able to experiment with all the different areas of nursing. I think that a lot of people going into the field don't really realize how many different paths that you can take, and it's not just a job where you have to go to a hospital or a nursing home. And through all of our rotations, some of them I liked, and I admit that some of them just weren't for me, but it was a really great experience through school because I was able to figure out what I like to do, and I chose cardiac nursing, and I plan on pursuing that after I get out of school. I would tell a prospective student that you really need to choose this profession for the right reasons. It's not about the paycheck that you make or anything other than loving what you do, because after you go through nursing school, whether it's a 2-year or a 4-year program, and then you start your career, you really need to love what you do and have a passion for this career.